All right, good morning, everybody. I'm sure some more people will continue to hop on, but we'll go ahead and get started. I apologize for the late start. I'm having computer problems this morning with my microphone, and so we got a little bit of a late start, but I think we're good now. My name is Paula Whitaker, and I'm with Hawaii Autism Foundation. We've been hosting these every Monday, these Zoom meetings, sort of a Q&A with experts on different topics every Monday, and we are happy to have you with us for this one. The meeting is being recorded, and we will share this recording with you after the meeting, as well as any resources that are presented during the meeting, any handouts, links to websites, all of that we will share with you after the meeting so that you will have that for your reference. If you would, please make sure your chat window is open. If you have a question during the meeting, you are welcome to type it into the chat and we'll try to answer it. Or you can just let us know that you have a question and we'll call on you to answer it yourself. I would like to take just a minute to introduce Daintree from the DD Council. Daintree has been super helpful, and the DD Council has been very helpful in funneling information to us, letting us know some of the things we need to know during this COVID-19 new normal. And so that's what we're going to be talking about today. The situation with COVID-19 is very fluid. Things change sort of on a constant basis. And so we want to be sure we give you the most up-to-date information. So with that, I'm going to throw it to Daintree at the DD Council and let her introduce herself and a few other people.
Thank you, Paula. Hi, I'm Daintree Bartolos, Executive Director here at the State Council on Developmental Disabilities, or well known as the DD Council. I also have Philip on it with me. Philip, you could introduce yourself from the Executive Office on Aging.
Oh, thank you for letting me offer my knowledge and what Daintree and I have been working on.
Okay. Okay. So just to kind of jump into things, what we have found from February, we started talking about the COVID. And as we see it is, if you can imagine, a tsunami coming. And we heard it's coming, it's starting from the East Coast, and we've been keeping ourselves informed. I assigned our staff, Chase Silbert, who will be talking a little bit to follow up on the COVID, what's happening, what are best promising practices, what are other states doing. And as it's coming to Hawaii, if you can imagine, we heard about it coming. So like a tsunami, we start taking higher ground because, okay, it's coming. But unlike a tsunami, it's not something that's going to come hit us and wash away. This is something that's going to be around for a long time. And as we've talked to other state councils from across the country, the states and territories, there's 56 of us in territories and then Washington, D.C., we have heard what they've been doing, what's worked and what hasn't worked. In Hawaii, we have talked to over 200 caregivers, 3 ADH programs, and 1 senior citizen program. And the most common question we get asked is, when can we go back to normal? When can we resume our daily activities like before? And that's just something that's not going to be happening. This is something that's really going to be changed for the next 6 months, a year. And at this point, I want to kick it over to Chase Silbert to just talk a little bit more about the background of COVID and what we're looking for our future. Chase?
Hi, can everybody hear me? So my name is Chase Silbert. I'm the Kauai Program Specialist with the DD Council. I work for Daintree. Basically, the national thing right now is that we're seeing protests that people want to go back. You know, their cabin fever. And the thing about Hawaii specifically is that we're doing a great job of actually flattening the curve. So the kind of issue with the fact that we're doing such a great job is that because we're flattening the curve so much and so well, it's kind of going to extend the time that we need to be isolating ourselves. Is that a negative thing? No, because that means less people are dying, hospitals are not being overrun, people are not spreading the disease willy-nilly. We're doing a great job of concealing it. The issue is that there hasn't been a lot of transparency regarding the timeline. So, for example, the proclamation only says that we're doing this until April 30th. However, from all medical and scientific experts, they're saying that this could easily go on until September and October. If we're looking at the DOE, they're looking at not opening up schools until there's no more cases of COVID being tested positive within the state. That's a high bar. So schools may not go back until anywhere from October to after the fall semester. And so the main thing I'm supposed to get across is that this is really going to last longer than we think it is. We might even see a point where we're allowed to go back out into the world and try to slowly ease these isolation techniques. However, that could easily cause a resurgence in COVID and another new spread, and we may have to come back and isolate again. So you might see a trend of going back into the world slightly, coming back and having to isolate again, and doing that over and over again in the next coming months. I can almost guarantee, at least based on the scientific data, that there's no way we're reopening everything come April 30th. The government will most likely have to extend that until March 30th and then May 30th. And realistically, the conversations for reopening a state or our state should be more towards June and the end of July is when it would be more realistic. Now, of course, everything I'm saying are projections. These are all based on just charts and data and things like that. So for example, Hawaii has had over 500 confirmed cases. 414 have already resolved themselves. We've had 10 deaths. But based on the positive confirmed cases to the amount we've tested, that means that Hawaii would have anywhere from 10 to 30,000 active cases of COVID, which is a very large number compared to the 500 confirmed. And this is, again, just a projection based on charts of other states that have had higher projections. But so basically the deal is that while there's a lesser shown positive cases, there's still a lot out there. And the timeline is just a lot longer than maybe the government is alluding to because they're trying to see how everything's going to play out. And I can touch more on any I talked about if there's any specific questions, but I think that's a good intro into everything.
Thank you, Jake. So with that, Paula, can you bring up the screen, the COVID-19? So where do we get our information? That's what other people, as Paula brings up the screen, where are you guys getting your information? What's going on? So what the COVID-19 Hawaii, there's a website from Department of Health, and it's right there. You guys could look this up. There's a lot of information that's coming out there. So we're asked, can you kind of condense it to what could really impact individuals with developmental disabilities? And it's just not for individuals with DD, it's for all of us. It's for our population, for our citizens of Hawaii. So this is the Hawaii COVID-19, our website. Go on it. I encourage you to go here and get the updates. Paula, if you could scroll back to the top of the screen, and on the right-hand side, guidance for all. If you click onto this, this will give you guys more information. And now you could scroll down, Paula. You're going to see that there's all sorts of information on here, resources, guidelines for you folks. And we really strongly encourage you to go here to get your updates. We did notice that there isn't a lot to do with congregate settings, meaning that people who go to adult day health programs, they go to different facilities, people who live in care homes or foster homes. What do we do? How do we protect ourselves? And these questions have coming up. And we've encouraged people to come up with a plan. What's going to happen if something happens in your home? If a family member comes home and they contracted COVID or they're exposed to it. And some individuals just said, can you please give us some sort of sample? So what we did is I worked with the Office of Aging, Executive Office on Aging, the Philip Anna, and we got information from 27 different state councils across the nation. We personally talked to 12 different councils to see what worked best, what was the best language they used with their participants, with their caregivers that was easily understood by everybody. And we came up with these 7 handouts. So I'm going to go over those handouts, and these will be shared with everybody. And this is the purpose of today, is to explain that this is something we have to be being prepared for the next 6 months to a year, about wearing face masks. What happens if I'm exposed? And so Paula, if you could bring up the first one, the COVID guidance to congregate settings.
Okay, can you see what's on my screen right now, or are you still looking at the website?
Yeah, we're looking at the website.
Okay.
And again, all of these will be handed out to you folks, so you will have all this information. And again, this is kind of a sample for the facility or the home that you run or work at. That's social distancing. If you could go back one to the guidance for congregate setting, it's the one right before this one. But after with the congregate setting, I could talk about in the appendix you bring up, so we don't have to worry about that. But this, again, what Chase said is with the COVID-19, we have to remember this thing is changing constantly, and how Paula talked. So what we give you today, there might be some things that have to be tweaked in it, and you'll be informed of that. So I need you guys to keep that an open mind that, oh, well, Daintree said this today. Things will change, and that's just the way it's going to be. But now it's not going to be a huge change that the whole thing is going to be wrong. There might be a better way to address something, and that will be given to you. The number one thing to remember with COVID is there's 3 places it enters: eyes, nose, and mouth. And this is from Josh Green, who gave a presentation on this. That was the biggest thing when COVID first came out. People were not protecting their eyes. That's why so many health caregivers were exposed to COVID. So we have to remember that. Josh Green did announce that it's very unlikely COVID would enter through an open cut. So we have to remember our eyes, our nose, and our mouths. And so as we go out to, you had it up, Paula, just left. Oop, there we go. So this is on congregate setting, and this, again, we just compiled. This one is Missouri gave most of our information on this one, and it just goes into the background of COVID. It talks about where it first came from, how it's coming about. And again, I think the most important thing is just to understand how COVID is transferred from person to person. If it's there, you get it through your eyes, your nose, and your mouth. It goes into this guideline, goes into the CDC guidance. And so we talk about CDC, so we refer you to different places to always make sure you can get the updated information. If you could scroll down, Paula. This document itself is 4 pages long, so I'm not going to go to each and every one of them because you will get a copy of this. But I just wanted to make sure that you guys had this. One part on part 2, we talk about social, right there. Recommendation strategies for, right there, you could stop, right there's perfect. Thank you, Paula. Assess your facility's ability to safely implement infections control best practices. So when we're talking about, people are asking, when can I return to my ADH program? When can I return to gatherings? We're still going to have to practice social distancing. So when the time comes when they're starting to open up our ADH programs, we still want to make sure that you understand the virus is still there, it's still contagious. And how can we roll in and start our day programs back up safely when the time comes? And other programs that we talked to across the state, the nation, excuse me, they talked about splitting their ADH program time so they have less people coming in the morning time. So they have like an 8 to 11 program, then they take 2 hours off and they have a 1 to 4 p.m. program. So those are things that you guys have to talk about. And how are we going to do this safely? How are we going to ensure that we sanitize everything? We still want to make sure that we have small groups, 10 or fewer. We want to practice social distancing. When our guys come in to sit at a table, make sure there's at least 1 to 2 chairs apart from each other. So these are things that we have to think about when we start up our programs. We do have a couple of senior programs that are still operating today, practicing social distancing and small gathering. So that is something that's happening today. They are keeping themselves free of the COVID. So that's something that we know we can do. We just have to really make sure that we practice safe practices. So once again, just reiterating, there's not going to be a time where you get a phone call saying, okay, go ahead, go back to your ADH programs as usual. we're still going to have to implement safety precautions and infection control. Again, eyes, nose, and mouth. Okay, you could scroll down, Paula, thank you. Right there's good. We have to make sure we communicate with staff and individuals about the virus and how to protect ourselves, explain the actions of what you're taking at your home, and provide information in a manner that's understood by everybody you serve. One thing that's really important is the screening for fevers. If someone is coming into your home, to your workplace, it is very important to make sure that they do not have a fever. That is one sign of the COVID. Again, you'll hear about asymptomatic. Not everyone shows the signs, so nothing is 100% foolproof. Again, all this information we have gathered is from the CDC website, from the COVID-19 Hawaii that you saw. We're just kind of putting it into a page that could be understood by service providers and individuals who care for people with disabilities. And so we just want to make sure that you understand the importance of screening when somebody comes into your home or your facility. And making sure if you're not feeling well, you stay home. That's the number one thing, is stay home. Protect, don't infect. That's kind of the motto. So we have to really make sure we practice that. You want to keep it? Yes, Philip.
In, I think it's attachment 7, it talks about visitors. There's a good form that the visitor fills out. And the first part is about the person that they're visiting, but the second part is about the visitor themselves, about the history is in regards to COVID-19. And if they answer yes to any of the second part, then they don't get into the care facility, because that's one way that a way of screening. So that an attachment 7 is a good one for visitors.
Thank you, Philip. And so, yes, so what Philip was saying is you want to make sure that when somebody comes to your home or your facility, if they have been traveling and they're coming to visit, like mom or dad went to a trip to Vegas and just came back, and they want to come to your house and see the individual, you want to make sure you screen for that and make sure that you say, no, wait 14 days before you come into our home. So we have to be very diligent about those things.
Daintree, I have one quick question on this subject.
Yes, Cynthia.
On number 7 that he was talking about.
Yes. Yes.
My paranoia is, can I ask the worker specifically if anyone else in their household is sick? Because I know of a doctor in Wahiawa Clinic that they did not ask those questions with their patients, and then everyone got sick because they weren't thinking about, if someone else in your household is sick, then you shouldn't come to work, right?
Yeah, that's a good point, Cynthia. And again, we're not trying to micromanage anybody. We're trying to let you folks know where to find the best promising practices, what is out there, what is good practice. And absolutely, Cynthia, you yourself as a parent, when someone comes into your home, feel comfortable to ask those questions. Absolutely. Those are questions that are being asked of other people, and you want to protect yourself and your family. So asking a question is not a bad thing, and encouraging people to be extra precautious is not the wrong thing to do either.
The other thing, Daintree, in the document under attachment 2, there's a good question about who's doing the charting for the congregate setting, and it was referring to hospital transfers when somebody gets admitted into the hospital. So I'm a novice regarding congregate settings, but one concern I had is whether the operator had enough staffing to do all of that work that's in front of them. I mean, it's quarantine one thing, but it's the other thing is to manage the facility itself. So,
Sure thing.
What happens to the staff in the process?
Sure thing, Philip. Let's wait one sec till we get there, but that's a good point to bring up, and I'll make sure that we touch on that as we get to that one.
Okay.
So what I can just talk about now, sorry. But so what Phillips is talking about is for licensed and certified homes, what we're providing to you is not replacing any rules and regulations in any licensed or certified home. This is just something above and beyond to be conscientious about. So licensed certified homes, you still have to have your relief. You have to follow the procedures that are in place. If you have any questions regarding that, you have to talk to your licensing person or your certifier. So we're not telling you that this replaces anything already. So you need to be aware, if I get sick, who's going to cover my home? Who's going to be responsible to care for those individuals? Same at your day programs. If a staff gets sick, how many individuals can I still have coming to work and meet this health and safety of individuals? So we have to be prepared for somebody who is operating a home, that I have my relief staff in place and I'm ready to go. If you look right now and you only have one relief staff, you need to look into the possibility of getting more substitutes, and you need to talk to your certifier and your licensing to make sure you have your backup that is needed. Again, this is not replacing any rules or regulations that are out there. You still need to follow them. If you have questions regarding that, you need to talk to your certifier. These are procedures that we need to put in place above and beyond, and we need to be prepared and ready for it. So that's why we're telling you about this today, is to get ready and prepare yourselves for a roll-in back into the new normalization. Thank you, Philip. So Cynthia, again, on prevention of FIVES into your home, signage, make sure you know who came into your home. If someone should get sick, we need to report that and let other people know. You could go ahead and scroll down, Paula. To increase capacity, that's with staffing, to keep the environment in your home free. Disinfecting is extremely important. We can't overemphasize that, to make sure you have a solution that you're disinfecting. We've talked to caregivers who said, well, we have hand sanitizer, so I'm teaching my individual how to use hand sanitizer. Soap and water is still the best thing, and that's on the CDC website. And if we teach our individuals today to really wash our hands good with soap and water, and to do that, you would like to take your participant's hand, put him in between yours and wash one hand, then wash their other hand, and then have them wash their hands, and just to continue to practice this. The reason you want to do it for them first is when they wash their hands and they're done, you want to be able to praise the individual, good job, not correct them right away, because that might frustrate them. So you want to make sure that they're using soap and water to wash their hands. If you run out of hand sanitizer and you're just teaching your individual to always use that, that's going to be really difficult. So remember, we're practicing 6 months to a year down the road, and we can't rely always on hand sanitizer. Soap and water is your best bet. So to keep going down, Paula. So we're talking about, again, detection in the homes. If somebody you feel was exposed, how important masks are. People say, how about I don't have a mask? And we've already gone into having a face protection, a bandana. You could take a shirt and cut a shirt. There's different on YouTubes. There's do-yourself making masks. Also, there's a lot of information that we've sent out about how you could receive free masks. Our self-advocates have purchased 4,000 masks, and that's through Zosimo Arista. You could email him, and he could help you guys set up if you have an individual 18 and above who wants to become a self-advocate and get some masks for the person, their families. That's something that we've been following up with. If we run out of mask or protection material, again, you could make your own mask. Something that you could use are goggles from snorkeling that covers your eyes and your nose. If you have to care for somebody who has COVID, protecting your eyes and nose is important, and goggles do work. So that's another way that you can have something. Your kid might be snorkeling, that could work as well. But the main thing is to cover them, washing your hands before and after you take off your mask or your gear. Protective gear such as a gown, people have asked where those are. They're expensive. They could be $13 each. So if you have loose fitting clothes, you could put over and layer and take off and wash. We've sent out other information on how to do that. So just remember, the most important thing is if you don't have something to protect yourself over, you can change your clothes after you have worked with somebody with COVID. Hopefully that doesn't happen, but more than likely we'll all experience somebody who's been infected with COVID before this whole cycle goes through. Go ahead, Paula.
I think that's the end of that document, isn't it?
Yep, thank you. So let's go ahead and talk about social distancing. That's another document.
Yes.
Again, it's very, very important for the social distancing, and we've been hearing about in the news, 6 feet apart, 2 arm lengths, 2 dogs, two medium-sized dogs side by back to back, that's 6 feet apart. So you want to practice that social distancing. And again, this is for the next 6 months. We want to practice this. And that is one of the best ways to do it. But as you've heard and we've read about, COVID does live on plastics and stainless steel. So disinfecting is so important as well. So here on this handout that we're giving out, we've talked about social distancing. We've also talked about sleeping arrangements. So if you have a home with 2 individuals, make sure their beds are 6 feet apart. It talks about if you can't have at least 6 feet apart in the beds, you can move their beds so their feet, so the feet are feet to feet to help keep their mouths away from each other. Because it's, as you know, if you speak, that's why we're saying masks for people who have or don't have it, that will help the protection. Meal times. Think about where you sit eating meals. You might have to do 2 shifts depending on how large your family is. So you don't want to all congregate around a small table and eat. So these are just little things to remember. Bathrooms. If individuals are used to getting up early and everyone takes a shower one after the other, we have to stop doing that. We have to sanitize the bathrooms after the use, after people shower and stuff. So we have to remember those little things. So these are things to prevent COVID from being transferred from person to person. So that talks about bathrooms. Transportation, when you go out, try to take small groups. Don't say, okay, we're getting claustrophobic, let's all go out for a van ride. That's not good either. You want to be able to stagger each other. So that's really important. You want to make sure when you talk, you try to keep the 6 feet apart distance. Activities, when you're playing activities, sitting around playing cards with each other is not a good idea. You're holding the cards, you're looking at the cards. Sometimes people put the cards up to their face. So you want to think about the activities, and passing cards around is not really a good game as far as it's concerned for social distancing. Yes, Philip.
One of the things I had suggested was for teaching some of the residents through PowerPoint, you know, because people with DD they learn by watching. So if someone could come up with a PowerPoint showing them what social distancing is, that'll be helpful. And even quarantining, you know, that's the big problem in the facilities is there enough room to quarantine someone? The CDC talks about having a separate room for those individuals, and
yep.
And so that's going to be the challenge for the operator is
correct.
Where do they have enough space? You know?
Yeah. Thank you, Philip. So that's on the next slide is, go ahead and bring that up. That's on self-quarantine basic facts, question and answers that we have. And I'm Tammy Everett, is Tammy Everett Consulting. They're working on plain language and PowerPoint presentations, and she'll be sharing that with everybody. And so what Philip was talking about, we do have some resources that you can share with your self-advocates, the people you care for, that shows pictures on how to do this as well. So we will have that available to you folks that we'll send out. Other states have also come up with that. So we will be able to send that out to you folks as well. We have Appendix for self-quarantine, which will go into if somebody needs to be quarantined, how can you do that? You can look at your house today to find out, how am I going to separate if somebody should be infected with the COVID, how are we going to make sure they have their own room? We talked about, and you can do that. You just have to look at your home and figure out how can you design it. Is there somebody's bedroom that you could isolate for just that person? And this is something all of us have to think about, not just because we take care for people with disabilities or the elderly, anyone in our family, if this should happen, what part of your house would be best for that? To make sure that when somebody is quarantined, you have paper products that you give them that you could throw away and discard. Again, these things are all on the CDC websites. We just put everything, condensed it into one handout that we can give you folks. But this is really important to think about. Think about, how are you going to make a commode next to the person's bed? You can purchase a self-standing commode. You can make one with a wooden chair and a bucket that you need to put by the person's bed. These are just things that you can do when you have to isolate at home or self-quarantine. There's ways that you can do it. And we'll be more than happy to share more information with you on that. But we just need to think about that for all of us in our homes today. What are we going to do if I get COVID? How am I going to quarantine myself at home to make sure I don't infect other people? And this will give you some guidelines.
I think that's really important. I was reading about the New York care homes. The problem was they did isolate them, but then they shared bathrooms.
Yeah.
So I love that idea. I wonder if we could find out if there's like a commode rental place, like a medical, there's got to be rental stuff. We could put a link out there. It would be really smart for people to have that at their house at the ready, you know, like a little commode rental thing.
Mm-hmm.
The medical suppliers offer that. Hawaiian Island Medical and some of your medical supplies would offer that.
Yeah.
As a way to rent. But there may be some people that are willing to donate some if they're not using them. You know, you'd have to clean them, but.
Yep, and it's just definitely something you could think about and how to do it. And we'll look into that too, Cynthia, thank you. Going to the next one, just looking at our time. Self-isolation, Appendix 3, also goes into that. It talks about recommendations for isolating protocol. Caregivers must understand that healthcare providers' instructions, medications, and care be able to assist the individual. So when we self-isolate, you want to make sure you have somebody who knows that individual, who's going to be able to work with that individual. That's really important. You want to make sure you cut down of the different people who work with that person. So these are things you want to think about today before somebody gets infected. Who's going to do what? When you're prepared, it won't be a crisis. You're thinking about this, it's going to happen. Somebody in your family will be exposed to the COVID virus or think they were exposed, and we have to be ready for these things. And so this is why we're providing this. Again, it's from the CDC guidelines, from other councils that worked, and we just put it in language that's hopefully easily understood by everybody. But we're here to provide more guidance or more explanation to something if you folks need it. So that is one of the most important ones. And as we talked about, being able to make your own separate bathroom area. Okay. So it says, what precautions should the individual in isolation take? The individual should remain in a separate room from other household members as, use dedicated linen, eating utensils for the individual, soap and water. It's really, if you can use paper products, that'd be great because you could just throw those away. If you're using glassware, silverware, make sure you wash it and disinfect it and it's separate than the others. So you just want to make sure you really isolate, so you just really contain as much as you can. Making sure that you spray your light switches, your remote controls, knobs, everything. You want to make sure you really get into a cleaning routine with you and your participants. Have the participants help as well. But I understand too, it's a chemical, so you have to know your individual for safety as well. But you really want to make sure you guys are cleaning your areas. That's most important.
Oh, I could say something. I took Lysol and I sprayed my light switches, and that was the wrong thing. They popped out from the wall and I had to call an electrician. But if you put alcohol only in a fine mist bottle, that's a better thing to spray electrical things with, because the Lysol went behind the light switches and expanded and popped them out of the wall. So
thank you for that. Most important is absolutely no visitors. And that's something that you just have to really be conscientious about. I know our individuals they could be attached to a certain somebody, but we have to be very conscientious about this because it's highly contagious. It will spread. If you know somebody is contagious, we have to isolate and no visitors whatsoever. Okay, going on to Appendix 4. This is caregiver guidance and how to provide care for a person who feels feverish, has a fever. We need to make sure we can help the person adhere to instructions to take their medications. We still have to follow through with that. The most important thing, again, is as a caregiver, when you're caring for an individual who's exposed or has COVID, very important to protect your eyes, your nose, and your mouth. Very important. Loose fitting shirt to make sure you have some sort of gown. You cannot be a hero and say, oh, I don't think I'm going to get the COVID. I never get sick. I could just do this. It doesn't work that way. So again, you have to make sure you protect yourself. It's just like when you ride an airplane when they said, put your oxygen mask on first before you help the other person. You need to make sure you are taken care of. And then people say, well, there's no personal protective equipment, PPE. Plan for that today. Have goggles, your snorkeling goggle as a backup, and a face covering. You cover your eyes, your nose, and your mouth. Then you have your gloves. But if you practice that and you have it ready today, you will be prepared. You don't need to keep constantly changing them because I know we'll run out of equipment that way. But as a last resort, you want to make sure you always have your eyes, your nose, and your mouth covered. I can't express that enough. Sanitize your mask after you go into the room and you help somebody. That's so important. And again, we'll be handing all these out, so I won't go point by point, but these we'll be handing out to everybody to get you, so you could have it. Again, you know your participants, you know what to do. You might want to tweak these. You want to go over it with your family and your staff to make sure you guys are prepared. You guys want to start, if you run an ADH program, you want to start putting these into place now. You want to think about what are we going to do? How are we going to protect each other? You want to make sure people are aware of this and you're talking about it. Are we going to have handy van pickup individuals? If so, what safeguards? Are we going to have our own van pools pick up and transport so we know who is on the van? You want to talk about this ahead of time and get these preparations into place. Then of course, yes.
The other thing, Daintree, is separating your vulnerable population from the infected person. So you could have someone that's, because of their age, that they're vulnerable, and because of the conditions that they have. So that's the other challenge, is how do you separate those individuals from the person that has COVID-19? At least they have the mild. How do you separate them?
Correct. And in the guidelines, it talks about keep older adults, those who have compromised immune systems, chronic health conditions away from other people who may have been exposed. This includes people with heart or lung or kidney conditions, diabetes, and cancer. So you want to make sure in your home, you know your individual's conditions, your families as well. And if somebody is sick, or all of a sudden they're sneezing more, or the condition changes, they're a little bit more lethargic, you want to separate. So you want to know that change in that person. The minute it happens, separate them, follow up with medical care, call their doctor, find out, say, my guy, because some of the guys, they're not going to be able to talk and tell us, but you know your participant, you know the individual you care for, they're acting a little bit different. Maybe they're a little bit more aggressive, or they're angry now and something's wrong. Make sure you call your health provider. Make sure you take their temperature. Make sure you monitor them. And if their condition is changing, you still have to write your incident reports. You want to make sure you call your health provider, you let your case managers know, the guardian know. So those procedures are still into place. But just really be a little bit more vigilant in picking up on different cues that they might be exhibiting. We've also talked about, like Philip was talking, Appendix 5. We could go to that. Appendix, oh, I'm sorry. And also if somebody, the caregiver guidance, if somebody is exposed or you think they are, don't forget to make sure you do the laundry separate. Okay. So a visitor 5, Appendix 5 is sample visitor form. So there's some questions here that you can ask, and Cynthia, you're talking about this too. Have you recently returned from domestic or international travel? This is a visitor come to your house. Or worker. Have you been close contact to a household member who has traveled? Have you been close contact with or care for someone diagnosed? Have you experienced any cold-like symptoms? So you could ask these questions. You could create another form. You could ask different questions. Again, these are just samples that came from CDC and other agencies from across the nation. But these are things you want to ask. Who was the person who said, okay, that visitor could come in? Again, this form isn't just for family homes, but it could be a facility as well. So these are just ideas. These are samples to get you guys thinking, because these are things you're going to have into place to make sure we keep the curve down and make sure that we don't transfer the COVID virus. So that's your sample visitor form. Lastly, I'd like to talk about, okay, the last handout, Paula, is a patient summary for persons with developmental disabilities. Now, this is for you as well. If we should get the COVID or we're exposed to it and we have to go to the hospital, more than likely, they're just going to take that individual and take them to the back. They may not allow you to go with that person. So you want to make sure you have the personal information and the symptoms, all this written down, because you may not be able to go with your individual. If you go to the ER, they might pull them away from you. So you want to make sure you have a form that everything's filled out to answer those questions. It talks about your personal information, current symptoms or risk factors, medical history. And you want to make sure the medical history has to do with their current condition, not a history of, well, it says history, but I mean, there are sometimes I've read these forms where the individual said, oh, the individual will run away from the house. They talk about some personal behaviors they might have. So remember, this is medical history, okay? You do want to put also on the very bottom, if you go down, patient allergies is very important. But down here, the patient's self-expression, likes and dislikes is so important. The person needs to know if the person can't see, they might not be able to hear. When they wake up, they might start screaming, they might start yelling, they get very worried if they're in an environment they're not used to. You want to make sure this is one of the most important sections you fill out for your participants, because if they're taken and they don't know these things, they can start giving over medications perhaps and stuff like that. So you want to make sure you take time to fill out this form for yourself, for your family members and the participants you take care of, so they know. Because if they have to go to the hospital and they end up going to the ER, again, they might be taken away and nobody is going to be with them for a period of time. So you just need to be prepared and ready for that. So those are the handouts that we'll be forwarding to you. Again, just to prepare you folks for the future. Again, 6 months, a year out, we're looking at the changes. So you need to be thinking about this. How are we going to, if I have a day program, how am I going to be doing this? If you send your participant to your client to a day program, what questions are you going to ask that program? Do you have social distancing in place? Do you have an area that you could isolate somebody if they should happen to get a fever while they're at your program? What is going to be your protocol? We're not trying to micromanage or tell you folks how to do it. These are things that we're going to need to do. And how you operate your facility, your homes, that's up to you. But these are some guidelines that are from CDC, best promising practices that we're giving to you folks just to help you with a template to get it going. Sometimes when you see it, it's easier to fill things in. Ask your staff questions, ask your family member questions to create some individualized forms that work best for you and yours. And that's all I have. So, Paula, I'm ready for any questions. You're on mute.
Sorry. I want to thank Daintree. That was a lot of information, and Philip as well. We really, this is useful information. Things change so rapidly, and it's really important for us to be prepared for whatever situation we might find ourselves in. I will again be sharing the recording of this meeting as well as all of those handouts and links that Daintree mentioned. All of this will come in a follow-up email to you later this afternoon, and so you will be able to have that at your disposal. I do want to, before I ask a few questions, mention that several people asked questions about things like IEPs, educational questions, things like that. Those are great questions and worth getting into. Not really what Daintree's and Philip's area of expertise is right now. And I want to encourage you to please check out our website, HawaiiAutismFoundation.org, and also our Facebook page. Our past meetings, which have been on education IEP services, adult services during COVID-19, handling negative behaviors, teaching life skills, all of those videos are available. So you can watch those, and we will be having additional education-related question and answer sessions as we move on through the next few weeks to answer new questions. But Daintree, there were a few questions that I think you guys could answer. One, we talked a lot about masks, but several people said, wanted to know what their sort of legal rights were, situational rights, if they have a person with autism in their family or that they care for that might not be able to handle wearing a mask. I know you and I have talked a little bit about what if I get pulled over, that kind of thing. Can you touch on that a little?
Absolutely. So the main thing is to do your best to try to get your participant to wear a mask. The lady I care for, almost impossible to keep a mask on her, but we're working on it every day. I got it when we walk outside, she go leave her mask on, but the minute we stop, she takes it off. So I get that. As long as you have your mask with you, a mask for that person, if you were pulled over or you're asked, they've already made that leniency for people with respiratory who cannot wear a mask. There is leniency there. Have the mask though, and just say, we're trying, he's not keeping it on. We had this come up a long time ago too when the seatbelt laws came out, and some of our participants won't keep their seatbelt on. They're still in a seat with the seatbelt. You do your best and you just say so. There is that leniency already. So an individual who doesn't keep on their mask, you're like worried, are they going to be able to? Do your best to keep that mask on. Do your best to avoid places that are a lot of social gathering where the person it would be more exposed. But all we do is make sure you always have a mask for that person. Try, keep trying, but if they can't, that is, you're not going to get a ticket for it as long as you've tried.
Daintree, I have something to share. Just last night we were watching on the news, and there's a lady that she was an athlete, and they found out that ski goggles were helpful for COVID-19. And in fact, one of the nurses commented that COVID-19 travels a lot into the eyes, and so this ski mask or ski goggles might be more comfortable. I don't know. It's something that they could try to see. Maybe it's a comfort level. Maybe something's more comfortable to wear. Mm-hmm. So that ski goggles they found success for this as another option.
Yep, that's a good point. Philip, you could try the mask, like the snorkel mask that covers the nose. You could try different types of material, because I know some individuals with autism, the sensory about the material. I had one parent that said they just pulled the t-shirt and it just stopped above, and they loved it. He had a t-shirt, he was playing with the t-shirt on the bottom, it covered his nose and his mouth. They used that. So I understand that there's differences, and we just do our best to try to figure out different types that might work for our individual.
Hi, Daintree. Oh, sorry, this is Nancy Partika. You know, if you can't get the gowns for protective, another option might be rain ponchos, the disposable rain ponchos. And I would suggest trying some of the places that are doing well economically right now, like CVS Longs. They seem to always have a supply of disposable rain ponchos, and you could actually ask for some donations of those, and they would be adequate for, you know, very temporary kind of gowns if you needed gowns.
Yep, absolutely. That's a great fact, Nancy. Thank you.
Yeah, they should be about $1 a piece. Even if you buy them online at Amazon or something, you can get them for about $1 a piece. UH also has them, but they're more expensive because they've got the Rainbows logo on them. But I'd ask for donations.
Thank you. That's a great point.
Daintree, I know we're getting compliance with Ian wearing a mask because he wears glasses and has hearing aids and has autism. So, and he'll have to wear a mask to go back to work, right? So one of the staff in his care home, their mom had made him he loves Transformers. She made him pillowcases for Christmas a couple of years ago. She had remnants of that cloth and made his mask with that. So finding fabric that maybe has one of their passions or things that they're really into on it might be a way to build compliance as well.
Thank you. That's really good. That's very good advice.
And Daintree, I will throw out too, in our life skills meeting we had last week, we talked about people with autism being trying to help them desensitize to that sensory input of the mask. And one thing we talked about was that a lot of times when we're trying to make someone put on a mask, they're associating that with something negative, you know, that they don't want to do. And so something that we found helpful at my house is to ask them, give them a reward. Like, you can play this video game for 15 extra minutes if you put the mask on while you're playing it, so that it's not associated with something, and it helps desensitize them. So I was just going to throw that out.
I had one parent call me and tell me that, and she sent a picture of her 2 boys with Spider-Man masks over their heads. They love them, and that's what they were. Their costumes. They love it, and so some guys who like to Comic-Con, they're just putting on these facial masks. That will work as well. And another thing important also, and Philip to remind me earlier, is if we're walking out, we have to model as well. So we can't expect everyone else to wear a mask and we're not wearing ours. So if your family gets in the habit, the minute we step out of the house, we all put our masks on, and we just keep practicing that. Even if we just walk to the mailbox, if we just walk and jump out the rubbish, put your mask on, okay, then you come back in, you take it off. So there's small steps that we can take to do that as well. And remember, our guys are watching us always. So if we're not doing something, they're not going to do it. So we want to make sure we're good models as well.
Okay, Daintree, another question that came up in the chat box. Are there any exceptions to the hospital rule? You talked about how someone may have to go back by themselves, but if someone has a child who might be nonverbal, have some significant communication issues, as well as behaviors and disabilities, did they make exceptions, or do you know?
What I was told is call ahead of time before it even happens and talk. There's a number, and I'm sorry I don't have it, I'll get it to you, that you could call, and you make sure you could set that up ahead of time. You know, this is my son or my daughter, the person I care for. What is the best, what should I do? How should I prepare for this? I've already been calling, I live next to, the closest hospital is Queens West. And at first they said, absolutely not, but we're working on, and they're saying, okay, one individual, who's going to be the individual, and identifying that individual and understanding that there will be a point where they will be taken by themselves, but then that person can be called in the back if the person starts to wake up, depending on their condition when they come in. So there's a number too, I'll call you, forward you, Paula, that you could give to other people about the hotline that you call. But you can talk to your care provider ahead of time to get that arranged, and it'll be a lot easier. What they're concerned about is a lot of times family, they come in packs. There's 3 or 4 people that come with the person. And so that's why also they're like, absolutely not. So it's something that we definitely can set up ahead of time.
Great, thank you so much. We had another question about legal rights for people who are at higher risk for contracting or having serious side effects from COVID-19. Do you know, like, what rights people have if they say, I or someone in my home is at higher risk? Are there ways to stay at home? Are there ways to have better protection at work? You know, it's just a general question.
That I really don't have a solid answer for, but I could do I could follow up and I could get you some information back of who the person they should talk to. I know that we've received emails from parents saying, you know, right now I'm told I must go back to work, and but I don't want to because I'm afraid I'm going to come home because my child is at high risk. They're able to get notes from the child's doctor stating that they're at risk, their child is at risk, and it could cause detrimental damage if they catch it and come home, and they're able to get family leave. But everything's a little bit different. The first thing is to talk to the employer. That's what I was told from the labor department, is talk to the employer and explain the situation for family leave. But I don't really, I'm not a lawyer and I don't really have any legalities, but I did follow up for just that one question. But I'll get you the number that people can follow up with to get more information on that.
Thank you. And then the last sort of general question, Daintree, is what services are available right now for our friends and family with disabilities?
Well, the same services that an individual is getting, except for the ADH programs. Now, that's something I really encourage. If you have an individual with a developmental disability, you don't have supports through Department of Health DD Division, you could still, their numbers are still there. You could call them up for intake. That's still something that's being processed and going through with. And I strongly encourage you to call the DD Division for that, for those questions. I was also asked, are my services now going to be cut because of COVID? Medicaid is Medicaid, and when Medicaid cuts come about, that will all come through to you guys through the Department of Health DD Division. At this time, we haven't heard any such thing. We have heard, like when an ADH closes, how they're going to switch over to support the individual. But really, you have to take those up. If you have DD supports today, you need to talk to your case managers about that. And there's a great video that DDD put out on the COVID website. If you go to that website, that talks about how do you contact your case manager.
Yeah.
So, but there's no, at this time, there's not an additional program or a special program set up for the elderly or people with developmental disabilities around this. It was just what you had before it and how things have changed and how they're going to proceed.
Okay, thank you so much. And thank you, Daintree and Philip and everyone who answered questions and participated. Again, this has been recorded and it will be available on our Facebook page as well as the Hawaii Autism Foundation website under the videos tab. We are hosting one of these Q&As every Monday, and we pick our topics by things you tell us that we need to talk about, questions you have and need answers to. So also in the follow-up email will be a link where you can suggest topics, ask questions, and people like Daintree and Philip and other experts in the area are working with us to help us find answers to those and host those meetings. So again, oh, go ahead, Daintree.
No. I'd also like to give a shout out to the other staff. I believe Roxanne Cahus, our staff on Maui, she's online and she's available to you folks for the Maui County. We have Jesse Floyd for Hawaii County. He's there. Zosimo Arista here in Honolulu. So he's here for our self-advocates and anyone in the Honolulu area. So we still have our staff. They're working remotely, but they're still available. And as we introduced Che earlier, who's our Kauai program specialist, but he's also helping me in the role of the community and legislative liaison position and helping me follow up with all best practices for COVID. So we're still out there. Please let us know if you have any questions, email us. We'll do our best to get you the answers or direct you to the right places. We get phone calls from labor people, from labor boards trying to file unemployment, from the stimulus check. So we do have resources and we'll guide you in the right direction. For DD individuals, really strongly encourage you, keep in contact with your case manager, let them know what's up, let them know what's going on. I know Mary Brogan folks are working diligently to assure they're supporting all of our individuals with DD in their program. So
I have one quick question. I know that there's a waiver participant that also gets some nursing services because she's doing chemo. Have you guys talked about if there is one of our guys really sick at home, is there any way we could get a nurse checkup in that COVID situation?
I've heard that has happened, but I really strongly encourage that person to talk to their case manager. You know, that is the most important, is to keep in contact with your case manager, let them know what's going on so you can plan things ahead of time. That's it.
Okay, thank you again, everybody, and stay well, and we hope to see you next week. Bye-bye.
Thank you, everybody. Thank you for this opportunity. Really appreciate it. Bye-bye.